What's the deal with the Johnson & Johnson COVID vaccine? It is all over the news and rightfully so, but what do you need to know? And I'm also answering the question about whether you should wait for that vaccine. That's right. A lot of my patients have actually said this to me recently. I've heard a number of people on social media say that they plan to wait for the J&J vaccine. Is that the right thing to do? I'm going to give you the answer today. Guys, I'm Dr. Jen Caudle. I'm a practicing family physician. I'm an on-air health expert, and I'm also a video creator doing videos every single day on like everything health related, also COVID as well. By the way, if you're interested in this type of content, please subscribe to my channel, click the little bell to get updates. Okay, so let's just jump right in. I got my little book with all sorts of nuggets of information for you. Let's start with some of the amazing pros of this Johnson & Johnson COVID vaccine. The first thing is that it is just one dose. That is right, one single dose. How awesome is that? Talk about one and done, right? That's going to make it so much easier for so many people to become vaccinated. Talk about ease. Oh my gosh, I love it. And something else that's really wonderful is that this vaccine does not need ultra cold storage the way some of the other vaccines need, which, by the way, that's going to be so helpful for shipment and delivery of the vaccine and even storage. You know, one of the reasons why I cannot give my patients the vaccines we have available right now is because my doctor's office that I work in, we don't have the storage capabilities with those ultra cold freezers. And so many other doctor's offices don't either. So having a vaccine that does not need to be stored at like subarctic temperatures is going to be an awesome thing. But there are other great things about this Johnson & Johnson vaccine. The trial involved around 45,000 people, so lots and lots of people. And there were a wide range of folks in the trials, which you know I love. Brown people, black people, white people, etc. There's a wide range of people from different ethnicities, races, cultures, etc. There was a very diverse population. Also a diverse population in terms of age, which is what we want. We want young people, we want old people in trials and things of that nature. And also, let's talk about safety profile, because I know this is something that really worries a lot of you, and rightfully so. You want to make sure the vaccine is safe. Well, the good thing is, actually a really, really good thing, is that this vaccine has certainly been deemed safe. It's got a favorable safety profile. And actually some of the main side effects are pain at the injection site, which of course you can get with any vaccine, not just the COVID vaccines, right? The flu shot, you know, other things as well. But also some fatigue, headache, and muscle arm. But overall, excuse me, not muscle arm, but muscle pain. But yes, you can get pain in the muscle of the arm, which you got the vaccine. But those were some of the main side effects. But yes, overall, very favorable side effect profile, safety profile. No person in the trial who received the vaccine experienced anaphylaxis. That's that severe allergic reaction, which is good. Now, let's talk about the meat, the nitty gritty, which is how effective it is, right? I'm gonna save the best for last, as we say. It's been shown to be about 66% effective at preventing moderate to severe COVID, but get this, it's about 85% effective at preventing the most serious illness that COVID can cause. Guys, that is huge. We're talking ICUs, ventilators, things like that. 85% effective at preventing severe disease. That's what we want, right? Okay, what we want is to keep ourselves, our family members, our loved ones, our grandpas, our grandparents, grandmothers, everybody out of the hospital, out of ICUs, not on ventilators, not severely ill. Super important. And another important thing is that in the vaccinated group in this trial, there were no hospitalizations or deaths. So we're talking awesome. I mean, honestly, this is really, 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 really good. Okay. Now, let me just go back and also say something that may be also on the horizon with this vaccine is that this vaccine may, and I say may, decrease the spread of COVID by people who are vaccinated. We still need to learn a little bit more about this. We need to learn more from more people in the trials, etc. But this actually may prevent asymptomatic spread. So that would be something, definitely is something we need to look out for. Let me see what else I want to tell you. The other thing you should know, by the way, guys, that this is not an mRNA vaccine like the Pfizer and Moderna vaccines are. This is a vaccine that uses an inactivated virus. The virus type is called the adenovirus, and what this does is it teaches the body's immune system to recognize and fight off SARS-CoV-2 virus, which causes COVID. Guys, I know this is like a whole list of things for you, but I wanted to go through sort of the highlight reel of this vaccine, because you're going to hear more and more and more about it in the coming days, in the coming weeks, etc. Now, let's answer the question of if you should wait for this vaccine, as some people are saying they want to do because they say they just want one shot or they like the side effect profile or whatever. The answer to that is no. You should not wait for this vaccine. Guys, you should get whichever vaccine you're able to get as soon as possible. If you're able to get Moderna's or Pfizer's and you have access to that right now, then you get that. Do not wait. The sooner that we all get vaccinated, the better, because remember that all these vaccines are highly effective. That is probably one of the most important things that we can remember, okay? So don't just sit on your hands waiting for the Johnson & Johnson vaccine to come up. Of course, if that's the only one or that's the one you have available, that's perfect. But if you have access to others, please get what you can get. Guys, thanks so much for watching. Please share this video with other people. If you're interested in content like this, I do it every day. Please subscribe to my channel and click the little bell to get updates. Guys, I'm Dr. Jen. I'll see you soon.